actually argued that people from lower socioeconomic backgrounds find it a lot more difficult to get into medicine. And I just wanted
Mhm.
to explore that kind of argument and that dialogue and that discourse about that. Like, so could you give us a brief summary of the article that you wrote?
Of course. So in regards to this topic, I would be interested in hearing your opinion as well, Nick, as you're a politics student. You definitely have some interesting insight into this particular topic. But summarizing like what I wrote in the article, it was talking about how students from more deprived areas, students that come from lower socioeconomic backgrounds, how they have a more difficult times getting into medicine, and whether it's due to culture within the school or whether it's due to the actual like the education system itself, or whether it's the way the society is structured and organized. Um, so it just all of the factors makes it more difficult for people from more deprived places to get into medicine, which the stats very much show. The stats do show that students from like low socioeconomic backgrounds have a much more difficult time getting into medicine, which is why there is very much few doctors who come from such families and from such areas.
So why do you think that is the case, that the majority of people from lower socioeconomic backgrounds, they go through and they struggle to get into medicine? And why is that an issue? Why is that an issue that needs to be addressed, from your opinion? Because people may have different interests, different aspirations, and what is the big issue?
So in terms of why that might be the case, so that might be the case. That might be the case because of how medicine is looked at in schools. So medicine is looked at as a subject that's only the very smart people can apply to, which is obviously not the case. And and it might be personal issues. It might be that they come from a relatively unstable background, which again will make it much more difficult for them to sort of focus on their academia and focus on the application and all of that. It could be so there could be a whole range of stuff. So on a micro level, it could be stuff like that. So the person itself and the school and the teachers and all of that. On a macro level, it could be it could be other factors that could make it more difficult for students from those backgrounds to get into medicine. In terms of why it's not a good thing to have doctors that come from mostly from affluent backgrounds. Well, well, if you look at the society as a whole, we've got people. Most of the people are from working class background. Most of the people um, are from working class background, and there's a lot of people struggling. And if you've only got doctors who come from affluent backgrounds, it's not a good representation of the actual society that we're living in. So is in an ideal world, we would want to have in the total population of doctors. In an ideal world, we'd want doctors to represent the ideal population that we do live in. So doctors coming from all sorts of backgrounds, not just in terms of the socioeconomic status, but also in terms of ethnicity and all the other factors. So so it's really good to have a good representation of what of the society that we live in.
Mhm. Do you think representation and diversity automatically breeds, not breeds, but like enhances competency and trust between the community and healthcare, and just an overall feeling that there is hope?
hmm So of course, like diversity and being inclusive and all of that is really important. And but ultimately, it's all about patient care. Ultimately, it's all about improving patient care and the outcomes. Um, so having students from all sorts of background is really important because it will help improve patient outcomes. It will help improve um, the doctors to understand the patients, because if you've got people coming from different socioeconomic status and different cultures, then you're better able to empathize with the patients, and that itself can be a huge difference in terms of the experience the patient has in their very vulnerable time that they're going through.
So fundamentally, the heart of medicine is being empathetic and trying to understand the situation that the patient is in, and then trying to adapt the treatments and the diagnosis from that.
Absolutely. So as important as the actual medicine itself is, and learning about the medications and the management and all of that, it's equally as important to empathize with the patient, to see their point of view, to get their ideas, concerns, and expectations, and manage all of the other aspects that's not medicine. And all of that is equally as important as the actual medicine itself.
See. So before we go into my opinion, and I know the listeners are really, really interested to hear that, but what do you think should be done if you were Prime Minister tomorrow, you're the new Rishi Sunak, and you had the power to decide policy regarding improving the opportunity and the access to medicine for people from lower socioeconomic backgrounds? What would be the first thing you do?
So, well, if I was the Prime Minister, I would take an individual as a whole. So I would take not just the grades, not just the entrance exams, not just the interviews. I would take every single individual's story as a whole, and their motivation, and as to why they want to study a certain course, and be much more tailored to that person. So you have to consider a person's entire story into consideration as well. So someone that's come from a very difficult background, but is still managing quite well in their education, and their motivation, and their other skills that will be very beneficial in becoming a doctor. If they have all of those things, then I don't see why they wouldn't be a good candidate to be a doctor.
So does that that's the life story and the experience. If the person doesn't get the specific amount of grades, do you think that this should be some sort of balance, that their life experience should, in a way, trump some of their, like, the grades that they didn't receive?
Absolutely. So just talking about what we talked about earlier, so about empathy and medicine being almost as equally as important, both of the factors. Someone that comes from a less affluent background, but has all of these other skills, but is not necessarily up to standard with their grades, then the other factors should definitely be able to balance out the grade factor, and that is something that should definitely be taken into consideration in terms of the application.
Thank you guys for listening to the North Wing panel, watching and listening. Sorry, we're both on Spotify and YouTube, for anybody who's listening and watching. But yeah, thank you for listening, subscribe, like, and we'll see you guys in a bit.